Hello, my name is Laura Anderson, and I am here today to tell my hip dysplasia story. So today is the 1-year anniversary of my periacetabular osteotomy procedure, and instead of writing an Instagram post or a Facebook post or something where I'd have to write, several walls of messaging, I thought I would rather get on here and tell my story. So I'll try and intermix some photos and other videos that I've taken throughout the year in here. If not, I'll put something at the end of this video. And if you're more interested in just seeing my updates, if you've been following my journey the whole time, that'll be more toward the end of the video. So let me start with my hip dysplasia diagnosis. So this kind of goes all the way back to 2017, so about 4 years ago. And I had just gotten back into distance running. In the year of 2017, I ran 3 half marathons, and I had been doing actually pretty well. So I had a friend that I ran a few of them with, and I think the year of 2017, not only was I running halves, but I was running a race every month that I could. So 5Ks intermixed in the months where I didn't have a half marathon. And this wasn't a problem until the final one that I ran that year, which was in December. And around that time, I started noticing that I was having some sciatic pain. And I just thought it was an overuse injury from running because I had been doing a lot of heavy mileage. So I kind of ignored it for a little while. So not long after that, I ended up getting pregnant with my son, who's 3 now. And throughout my whole pregnancy, I still struggled pretty bad with that sciatic pain. But I didn't really know what to think of it. It was kind of off and on and depended on what was going on as far as how active I was or how pregnant I was. But I mostly noticed it went away after my son was born in September of 2018. So after my son was born, I got back into running, and 2019 was a heavy running year for me. So I ran another 3 half marathons over the course of the year. And the first 2 I ran went really well. The second one I did, I actually got a personal best as far as time goes. So I was getting faster, I was feeling stronger. My weight was in a good place where I had been able to maintain a healthier weight for a while, and I was just feeling really athletic and healthy and doing really well. Until the end of 2019, I started really having issues again. That sciatic pain came back full force, as well as some other weird symptoms that I hadn't had before. So I'd had that sciatic pain off and on since 2017, but I had not had some of these other weird pains that I couldn't really identify at the time. It came to turn out one of those pains, it was trochanteric bursitis. As well as I just started noticing there was just more pain in my hip flexors. The whole side of my leg felt really messed up. So I think my first appointment with an orthopedic doctor was February of 2020, if I remember correctly. And I told my symptoms to this doctor. He did a couple basic tests on me, and he was like, yeah, it's probably just a running injury, probably piriformis syndrome, which is a form of sciatica caused by a tight piriformis muscle that sits over the sciatic nerve. It's kind of a deep glute muscle. So I was like, that sounds right. That sounds great. What do we do? And so he prescribed to me 6 weeks physical therapy, pretty common conservative treatment. So I go to the physical therapist. I do 6 weeks of physical therapy. And while I really enjoyed physical therapy, in this situation, not only was my pain not improving, but it was getting significantly worse. And I could tell that I was going downhill really fast, that my physical abilities and were getting lesser, and my pain was getting consistently worse throughout the course of this physical therapy. So I went back to the orthopedic doctor, and he decides to do some testing. So we start with some imaging. We do x-rays. We do initially an MRI of my whole hip, the pelvic girdle, that whole area. And then they do one of my lumbar spine as well. And this was just a general orthopedic doctor, and he gets my imaging back and he says, honestly, I'm not really sure what's going on. And so he referred me to a hip specialist. So he refers me to one of the best PAO surgeons actually in my area, who looks at my imaging, and I have my first consultation with him, and he knew exactly what was wrong with me very quickly just from looking at my x-rays, since he specializes in hips. And so this is when he gave me pretty devastating news about my diagnosis. So no one had thrown around the phrase hip dysplasia to me yet. I literally was just under the assumption that I still had a running injury or maybe a bone spur or something that could be just a teeny little scope surgery or something to resolve. And he tells me that I have left hip dysplasia. So for those of you who aren't as familiar with hip dysplasia, or those of you who think it only happens in dogs, it's essentially where your hip socket is kind of too shallow and it doesn't keep the femur in place very well. And so you've got joint instability in your hip. Luckily, I only have it on the left side, but some people do have it bilaterally. And part of the reason this diagnosis was so kind of devastating to me is because I do actually have a sister who has bilateral hip dysplasia, and I know what that can mean. And I remember her telling me about a pretty barbaric sounding surgery that they can do for that way back when she was diagnosed, though she did not go through with that. But my orthopedic surgeon starts to explain to me what a periacetabular osteotomy involves. For those of you who don't know what that surgery is, they make 3 bone cuts in your pelvis to essentially cut that hip socket out, and they rotate it to have better coverage of the head of that femur, and then they screw it into a new position. It's an intensely invasive surgery with a very long recovery. So my surgeon, I think, told me it was a minimum year recovery for this surgery, and I've also heard it is one of the hardest recovery and most painful elective orthopedic surgeries that you can have. So to say it rocked my world to get that news is an understatement. So I asked the surgeon what the next steps were, and he told me they typically will do what they call diagnostic injections. Where they did an x-ray guided needle into the hip joint, which was not fun. They had done one of those for my hip MRI as well, but this one was far worse, and they put, I don't know, steroids and some other things in there. The idea was if this injection helped with pain for a little while, one, there'd be some pain relief, but also my surgeon told me that typically means that the surgery will help provide some pain relief as well. So I go in and I get the x-ray guided injections, and I had worse pain for like significantly worse pain for probably about 2 or 3 days after the injections. And then I noticed a pretty significant improvement in my pain for at least 4 or so weeks. So with this news, they went ahead and scheduled my PAO, so periacetabular osteotomy procedure. And so that probably would have been, I have to think, they probably would have scheduled me in June for my September surgery, because they do it for at least 3 months out. You have to wait a certain amount of time after getting those injections before they can do any kind of surgery. And so the date was set, and I had to mentally prepare myself for this surgery. So the most major procedure I had had up to this point was a dental implant. So I did have to get a bone graft and do post and a dental implant. I've also had some root canals and stuff. And then when I had my son, all the fun stuff that comes with that. But I didn't end up having a C-section or anything. So I'd never, other than a spinal epidural, I had never been under any anesthesia or anything like that. So I was pretty nervous for my first real surgery to be such a major one. But I prepped for it. And I mean, if you go back and follow any of my journey during that time, just really nerve-wracking. I learned as much as I could. I watched other people's YouTube videos. I found lots of Instagram accounts. There's luckily a really great hip dysplasia community on Facebook and Instagram and some social media sites where I watched other people's recoveries. I saw what people's suggested lists were for what to bring to the hospital and everything, and kind of tried to prepare myself that way. And as the time approached, the dates, this is middle of 2020, there's no COVID vaccines yet or anything like that. So I have to be really careful to isolate. I got COVID tested a couple times. I had to test and isolate before my procedure. And then the morning of September 21st, 2020 came around and I went to the hospital for my surgery. So I felt really ready the morning of my surgery, but also really nervous, unsurprisingly. I was not allowed to have any visitors or anything with me in the hospital due to COVID at the time, but luckily I was kind of in between where they were canceling surgeries. So they had been canceling elective procedures and then they started doing them again. And so luckily I was able to actually have this procedure. But there that morning, I had a pretty early check-in time. I can't remember off the top of my head how early, but it was pretty early. And, they took me back to the surgery prep room and they're running all the tests and everything that they need to do. They're taking the little roller that does your temperature over my head over and over. Because even though I had tested negative for COVID and everything, I was running like slightly warm. And so they were really nervous and I was really nervous that they were going to cancel my surgery because of it. But that ended up being okay. Sorry about that interruption. But they're doing all the tests and they give me an IV in the back of my hand. And for this portion, my husband, for the prep, sorry if you can hear the water going off, my husband's giving my son a bath. But they're doing all the stuff for the surgery prep. They give me an IV and my husband was able to be there with me. So they collect my belongings to go to my hospital room later. And the nicest anesthesiologist ever came and spoke with me that morning. And she tried to calm my concerns. And so I told her, I was like, I am really nervous about waking up in uncontrollable pain. I'm really nervous about waking up with uncontrollable nausea. I told her with dental work in the past, I have been pretty resistant to dental anesthesia. So like when they numb your teeth and stuff like that, lidocaine or whatever they use, doesn't work on me very well. And I was just, told her about the things that made me really nervous and she listened really well. And she's like, I will monitor you so well. And she talked me through it. And they gave me a big cup of pills to take, which was funny because, they don't let you eat or drink anything before a procedure like that. And I thought it was funny that they gave me just this giant cup of pills to take. And it was like, okay, I hope I don't, aspirate those or whatever the word is for that. Anyway, so it gets time. I think my surgery was probably scheduled for 7:30 and 7:30 came and went and I had not been wheeled back yet. But it gets to be around, I want to say 8 a.m. I'm watching the clock real closely. And they finally decide that they're about ready to wheel me back. And that's when my husband has to leave and he's not going to be able to see me until it's time to pick me up from the hospital. And this surgery is typically only done as an inpatient procedure. So it's really common to have at least a 2-day hospital stay after this, but some places a lot longer. Honestly depends on how you do and what country you live in and that kind of thing. So they give me some kind of drug in my IV that is, they said it was to relax me. I don't know what it was, but I think it's that same drug they give you that kind of makes you forget too. But they wheel me back into the surgical room and they get me all ready to put in my spinal block. And that, as far as the surgery goes, that is the worst pain from the whole thing that I can recall. Was for some reason when they put that spinal anesthesia in, it hurt. 12 out of 10 pain. It was very short-lived, but they had me leaning over something so that they could try and put that into my back. And I remember I'm pretty drugged up from whatever they gave me, and I just remember kind of pushing back in pain. And they're like, what's wrong? I'm like, oh, it hurts so bad. And at that point, they have me lean over again, and I'm starting to feel really out of it. And that's the last thing that I remember before my surgery. It's completely black from there. I'm sure there was at least a short while after that I was still conscious. That is just completely gone from my memory. I don't know if it was the drugs. I know that anesthesia itself can sometimes affect your memory. But the next thing I know, I woke up in the recovery room. Next thing I know, I wake up in the recovery room and things are good. My fears did not come to fruition. I was not in uncontrollable pain or nausea. I actually felt fine. I had a really cool nurse in the recovery room, and he did all the stuff they're supposed to do, checking my feet and making sure that I'm kind of coming out of the anesthesia safely. There was another guy to the side of me that was kind of coming out of it at the same time. And I was barely conscious when this guy phones up my husband and talks to him on the phone and says that I'm doing well and hands the phone to me. And I remember being handed the phone, and I remember talking to my husband very briefly, but who knows what I said. I was still so like out of it from anesthesia. But I remember the first time I looked at the clock in the recovery area, it was probably around 10:30 a.m. So my surgery didn't take actually that long. For some people, it takes a lot longer. I think mine was under 2 hours because they wheeled me back just a little after 8 a.m. So I think mine was either just under or just over 2 hours for the surgery. But I remember looking down and finding all those little, I don't know, electrodes or whatever, those little sticky ones they stick to you. I remember like looking under my hospital gown and seeing them like on my rib cage and on my chest and just everywhere, and feeling just a little bit violated. I'm like, okay, I knew people were going to see all sorts of parts of me in a surgery, but just seeing them like, oh man, like a bunch of strangers have seen every part of me and stuck electrodes everywhere. And I guess that's just a thing, right? So anyway, I was in this recovery room for probably a lot longer than I wanted to be. So I didn't have any of my stuff with me. I'm sure that's normal. But and the great recovery nurse, he ordered me food and I had no appetite. I honestly didn't have any appetite for like a month after my surgery, which was a little sad when that came back. But they were short on hospital beds, so by the time they finally got me to my room, it was past 3 p.m. So I was in that recovery area for hours, and they finally get me there. It took another hour or two for them to bring me my personal effects, and so I pretty quickly called my husband from my hospital bed phone, the one they like wheeled over to me. I had to ask them, I mean, I couldn't get up. This is super major surgery, and so they had to like wheel everything over for me. But I called him and I gave my room number to a couple people so I could talk to him and let them know I was doing okay. And I just remember my throat being so froggy and dry from, I'm sure, when they intubated me or whatever for surgery. And I just remember just like, again, so dry, so froggy. My voice, I felt like I'd lost my voice, but I actually felt pretty good. So my hospital stay, I'll go through this somewhat quickly. It's a little bit of a blur. That first day, I just slept a lot. And just like anytime you stay in the hospital, it's similar to when I had my son. Nurses come check on you every couple hours. They come bring you pills. They take your vitals, you know, blood pressure. And they had to give me blood thinner shots in the belly, which was terrible. They're like, this just feels like a bee sting. And it sure did, right in the belly, and it was terrible. And they had to give those to me, I think, twice a day, if I remember correctly, and they were just not fun. But overall, the hospital stay wasn't bad. The only food I really felt like I could stomach there was like they had cans of ginger ale, so I drank that, kind of sipped on it. And then with every meal, I ordered a little cup of, they had blueberries, and I don't remember some other kind of berry. I just really remember those blueberries for some reason. And I got those with every meal, and I always at least finished the berries, but I hardly touched anything else. I had no appetite. And so from what they told me, it's pretty normal to not try and get you up out of bed that day of the surgery at all. So the day after, so I had surgery on Monday, so this would have been Tuesday, the 22nd. They try to get you up out of bed. At least that's what they tried to do for me. So the first time they try to get me up with my walker, I am just totally passing out. My blood pressure is all sorts of wacky. And so they try a few times throughout the day. They bring in physical therapists and things, try to teach me how to get up with the walker and go around. And anyway, I kept almost passing out. So eventually I finally got up and was able to get to this little chair they had in my hospital room, and I sat there for a little while as I started to pass out in the chair, and my blood pressure was really low. Anyway, so once they finally got me to the point where I could walk her around a little bit, which was so hard. They literally had to cut through my hip flexors to get to my hip. You try moving your leg forward to walk, even with a walker, when someone's cut through your hip flexors. It's terrible. But they took out my my Foley catheter at that point, which was normally I wouldn't even say anything about that, but that is of note because my blood pressure was still really low. So they gave me like 2 bags of saline right before they took my Foley catheter. And so that night, I had been able to get up pretty successfully, but it took like a whole team. So they'd have to lower the bed. Someone would have to help me move, like literally physically lift my leg and help me shift. And it was just a painful, terrible, awful ordeal. And I was up all night that night, every 30 minutes to use the bathroom because they just pumped me full of fluids. It was terrible. It was so bad. And so that was by far the worst part of the hospital stay. Overall, I had really good nurses and care, and I was able to go the next day. So Wednesday, I think I was out of the hospital sometime in the afternoon and went home. And the first little bit of recovery was pretty rough. So getting home, the first thing, they don't even let you leave the hospital until you can do a few things. So the physical therapist helps you learn how to use your crutches. They have stairs that you can go up and down on. If you have stairs in your house, you have to be able to use those before they'll let you leave. They had a little fake car, so you could practice getting in and out of the car and all of that. So I passed all those tests in the hospital. Like once I finally got home, and the car ride was so painful, every jostle was just like terrible. But once I got home, I just knew I was going to go upstairs and stay there because my bedroom is upstairs in my home. And so I was able to get upstairs on my crutches. Coming downstairs on crutches when you can't use your hip flexors is terrible. So I was not even going to attempt that anytime soon. I was obviously exhausted. And we had a like a lazy boy recliner in my room, and that was my bed for the next 1 to 2 months. I don't remember exactly when I started sleeping back in my normal bed, but I basically set up camp in a lazy boy for almost 2 months. So the first 3 or so weeks were by far the hardest. The 3rd week was probably the worst for me, the 3rd week post-op. The first week I was still pretty drugged up I had a lot of painkillers and things. I didn't sleep well this whole time. I didn't sleep well. I was up all night, almost every night. But I was trying to do just a little bit more. The first couple weeks, I primarily used a walker to get around. At some point around the 2-week mark, I switched to trying to use my crutches instead. And from that point forward, I mostly used my crutches. Just depended. Getting to the bathroom and back was always an ordeal. We did have a raised toilet seat with like handles to help me, which is fun. I had a shower bench that I had to use, and let me tell you, showering was its own kind of ordeal. Showering helps me feel so human, but we ended up getting one of those shower head things that's got the extendable one that you can kind of use and like take off from the top, and it's got the cord, if you know what I'm talking about. But I wasn't supposed to, especially until the bandage over my incision. It's about a 6-inch incision on my hip, going from kind of my lower belly to my upper thigh. And I was not supposed to get that bandage super submerged or wet. And so we had to like saran wrap my hip every time I would take a shower. It was this whole ordeal. My goodness, it was such an ordeal. I mostly slept in t-shirts, dresses, or like big like sleep shirts from Walmart. Someone referred to one of mine as a moo-moo, and like one of my Instagram posts, and I was like, yeah, actually not far off. But I did not want anything like that. Incision goes right over where any underwear or pants would sit, and I did not want anything tight there. Every time I laughed or sneezed, it hurt so bad, so much pain. And then definitely, I was pretty minimal with my painkillers, but all the digestive stuff that comes from that was a real struggle, especially around the 3-week mark. I couldn't take my stronger painkillers, and so for me, it was like, I'd rather deal with the pain than the nausea, and it was rough. I'm gonna be honest, the first month was hell. It was so bad. There was a point around the 3-week mark where I was begging my husband to kill me, and it did get better from there. So my surgeon's protocol let me do up to 50% weight bearing. So basically if you're standing, you can stand even, you just can't shift extra weight. I try to be really careful with that. Different surgeons have different protocols for how much weight you can put on your leg. But with all the crutching I was doing, I was getting super strong arms. Things got better. I tried to do more and more as time went. And at the 6-week post-op mark, I had an appointment with a surgeon who looked at my x-rays. They looked good enough that I got the okay to start physical therapy. Physical therapy is where I saw the biggest gains. I went twice a week and they probably got so sick of me. But over the course of a few months, I was able to go from 2 crutches to 1 crutch to a cane to walking without a limp, which took a long time for me. So I think it probably wasn't until February of 2021 that I was walking without a limp. So definitely a few months later. Definitely took longer than a lot of people after the PAO surgery. But from there, you know, I just kept getting stronger. I got to the point where in some of the exercises, my left side was actually stronger than my non-surgery side, which is so funny. But continue to get stronger, and actually got to a point where I took a test where they like a running readiness test, and I passed the test. It just involved a lot of different exercises and hopping and being able to hold the plank and doing things for time. And just once I passed that test, they gave me the approval and they put me on a back into running program. And then I continued physical therapy for a little bit after that before I started trying to do it on my own at home, mostly due to the insane cost of going to physical therapy twice a week and running out of appointments from my insurance. At some point, I had my 6-month follow-up with my surgeon, and that was one of the times where I felt really frustrated because up to that point, I had been 6 months post-op, making huge physical gains at physical therapy, improving so much, and I was still struggling a ton with chronic pain. Just all of my pain was still worse than before surgery, all of it. I had terrible bursitis in that greater trochanter area on that left hip. I had nerve damage from the lateral femoral cutaneous nerve, so the one that's like gives you feeling to the front of your leg, basically, getting stretched during my surgery. And I was just feeling really frustrated that in my head, I'm like so far out from surgery, 6 months, and still seeing so much pain, because wasn't the point of the surgery to help with pain? And my surgeon seemed really confident that the surgery should help with that. And he was really dismissive of my pain. He said, give it 6 more months. By the 1-year mark, you'll be feeling great. You'll have very little pain. This felt dismissive to me, unsurprisingly, but I just continued doing what I could, increasing my activity, running when I could. Running was an interesting thing to get back. All of this is chronicled on my Instagram page, but I had to start really slow. I haven't really been able to do above 4 miles since my surgery, which I know to some people, especially people who don't do a lot of running, that sounds like a lot, but I can't imagine being able to do more than that right now. And I used to run half marathons, so it's just one of those things that it is an improvement. But then sometimes when I run, the impact just makes my pain so much worse. Anyway, that's a little bit of a tangent from the story, but so between my surgery and 6 months, I just felt terrible. My pain was worse than before my surgery. I was feeling really discouraged. Things weren't getting better. And then I actually felt like I turned a corner somewhere between 6 and 9 months where I was seeing really big pain improvements. And during this time, I tried a lot of things for pain. I got a legal medical cannabis card in my state, and I started using medical cannabis, and I do feel like that helped. I haven't been taking it for a while, but I felt like that was one of the few things that actually did help quite a bit with my pain. I don't want to throw around like phrases like miracle drug, but kind of. It also helped with a lot of the post surgery anxiety and kind of depression symptoms that I had been having pretty severely. And so anyway, around 6 and 9 months, I felt like I had turned a corner and was really improving, and I was running more, and I was going on long hikes again and other things to improve my activity. Somewhere around the 9-month post-op mark, I unfortunately started kind of backsliding, or at least pain-wise, that's how I felt. This whole time I've had improvements in my mobility, my pain, just gradual improvements. I've been able to increase exercise frequency, duration, intensity, high impact in exercise. I've slowly been able to ramp that up the whole time. But for some reason, my pain had been really improving, and then it just started getting pretty bad again. And that was really discouraging. I had been at this place where I was slowly building up my running, and I felt like I could run at all without significant pain anymore. So coming from someone who loves to run, that was really discouraging, to say the least. Back to present day and my present day update and kind of where we're at right now. And some things I glossed over. More details, especially the first few months, you can find it on my Instagram, which is feeling hip. I think it's feeling_hip, but I'll double check it and put it somewhere, maybe in the link or something. But I've been at a weird point where I feel like the improvements have been slow. I think they've been slow this whole time, but let me think about my thoughts at the 1 year mark, like what I would want to say to people who are considering the surgery, or what I want to document for myself. But this past year has by far been, feeling emotional now, one of the hardest things I have ever had to go through. Sorry, here comes the waterworks. But physically, I feel like I spent so much of it just being in recovery mode, like go, like gotta recover, gotta get better, gotta be faster, gotta be, the person at PT who's putting in the most work, gotta get back to running, gotta get back to dancing, gotta get back to all of my previous activities. And in a way, I was very successful in that. I am back to dancing. I don't quite have complete hip flexion still at the 1 year mark, but it's gotten a lot better. My hip flexor strength has improved a ton. So I'm back to dancing, minimal running, but I've still been able to do long hikes. It's been great. And the biggest thing is I look back this time last year and I felt like I was losing my ability to walk. I had a lot of muscular weakness through my thighs and my leg, and my pain was just constantly getting worse, and I just felt like I was losing my ability to do anything that I loved to do. Whereas this year, especially once I got past the 6-month mark or so, I was able to, I bought roller skates and started trying to learn how to roller skate, and I've been back to long hikes. I've done some 7 and 8 mile hikes, and some pretty steep ones. I live in a pretty mountainous region with steep hikes, and I've been able to do that again. And I ran my company 5K a few months ago, and I'm probably going to try and run another one in a couple weeks, and some of that kind of stuff. So I've definitely seen improvements, and I would say I am certainly doing better with both pain and then also just not feeling like I'm constantly losing the ability to do the things I love compared to this time last year. So in that sense, I feel like this surgery so far has been a success. I do know there's a lot of people in the community that say that 1 year they weren't fully recovered. Some people took multiple years, and I have a feeling that's going to be the case with me. I still have bursitis that acts up. I still have some nerve damage to the front leg that may be there forever, though it's improved a little, so I'm hopeful. And I still have sciatic pain. I will say I don't feel like I'm slowly getting worse anymore like I did feel before my surgery, but I still live with daily chronic pain in that hip. So I think that's another thing. I'm just going to keep giving it more time, keep working on staying mobile. I teach yoga classes, so I'm going to keep teaching yoga and practicing myself. I'm going to keep dancing, anything I can do to stay active. Going to really strive to see if I can keep lifelong healthy weight, because I know that's better on the hip joint. And hopefully this hip lasts me another 10, 20, 30 years before I have to get a hip replacement. My surgeon did say that for people with hip dysplasia, it's generally not a question of if you'll get a hip replacement. He said it's generally when. Though some people, you know, this procedure hasn't been around long enough. We don't really know if people can go, if it can really last forever. My biggest thoughts to finish this 1 year is, I can do hard things and you can too. We're stronger than we think we are. Take the help you can get. I had a lot of people that helped me during that time, even with COVID, which was crazy because we didn't really feel like we could have a lot of people at our house or anything like that, but a lot of people helped with food, and my sweet mom sent me so many fun craft projects to do while I was sitting bored out of my mind in a lazy boy chair for 2 months. My work did a pretty good job trying to make accommodations for me when I came back. I did go back to work around the 10-week mark. I was approved for 12 weeks off through short-term disability, and in hindsight, I wish I had taken all 12. I think I was physically okay to come back. I was still on a crutch at that point, but I wish mentally and psychologically, I wish I'd given myself those 2 more weeks, if that makes sense. So with this whole thing, I don't know what's really harder, the physical aspects or the mental aspects. There's huge amounts to both. A lot of tears, a lot of mental and physical anguish, a lot of successes, a lot of really good days. And at the 1 year mark, I'm at a point where it's just, maybe we're at the acceptance stage of grief a little bit, for where we're at, in addition to continuing to try and grow and strengthen and develop and maybe hope that someday we'll be pain-free, but having some chronic pain might be my existence, and this is still better than it was. Am I glad I did it? I think so. It's hard to say. It's like hard to say that you put yourself through the hardest thing you've ever been through and you're happy you did it and that you paid a ton of money for it. I do think it helps me develop and grow as a person, and I do think that I don't want to know where I would be if I hadn't done it. Like, I was going downhill so fast with pain and my mobility and everything, so I think I made the right choice. So I'm going to put some photos and things at the end. Those of you who are still here, I know this was a very long video, so thank you for tuning in. And if you have any questions, you can leave them in the comments, or you can go to my Instagram or whatever way you want to contact me. And there's obviously a lot of stuff I left out, but if you have questions about anything, or you can always, again, check my Instagram. I chronicled a lot of it there. Thanks.